Well, I mean, right now we have just over 100 doses of Johnson & Johnson on hand, so we're pausing the use of that, and we're using only our Pfizer and Moderna, and 98% of our doses that we have on hand are Pfizer doses. There is some concern that it could cause more vaccine hesitancy. I mean, we're seeing the data still shows that these vaccines work. We've seen a sharp decline in the number of cases overall compared to where we were in late December and early January, when we had over 250, close to 300 cases per day. So we've seen a decline. So the vaccines are working. The data is showing that it's working especially well among our older population. That is, those hospitalizations have went way down. So this could cause some hesitancy. But obviously we're wanting to be cautious with the J&J vaccine, but we still have the Pfizer and Moderna that we are using at our vaccine events. Well, we are working with those individuals that we have given the vaccine to, and they know those organizations that we've worked with can reach out to us. And we, again, reminder that this is very rare. This issue with the blood clots that we're hearing about, it sounds like it's almost a 1 in a million chance. But we want people to be cautious. If they have a provider, they need to contact their provider. If they don't, we would advise someone to call 911 if they start to have major health issues and complications. But with our homeless population, we are pausing the outreach efforts and any efforts with the Johnson & Johnson vaccine at this time until we can get further guidance. We did not have, we only have 120 doses of Johnson & Johnson in our inventory versus almost 5,000 doses of Pfizer. So we had no Johnson & Johnson appointments planned at this time anyway. So this will not cause any ripple effect. It is pausing some of our outreach efforts that we had planned, but that is it. And I think the thing we have to consider just in general, before today's event, we were talking about last Friday, just the vaccine, and it's already been mentioned, vaccine hesitancy. But we do have to realize that a lot of individuals that are coming forward, the Johnson & Johnson vaccine in particular, want to come because it's only one shot. So they have a concern or hesitancy around needles. So that can cause some of the anxiety. Obviously, what we're talking about today with the blood clots and the reason for the pause in the Johnson & Johnson vaccine, this is more serious than that. We have not had any cases of these blood clots with any of our patients, and not heard of any reports in Forsyth County of that or across the state. But we will monitor that. And again, that's why we are pausing the Johnson & Johnson vaccine at this time until we get further guidance from the CDC and DHHS.